everyone, my name's Sherlyn and I'm a student nurse and paramedic based here in Melbourne, Australia. This is my video journal where I reflect on things I've learned in my degree. Okay everyone, so full disclosure, I love ECGs and I'm really excited for this presentation. I understand that ECGs aren't everyone's cup of tea, and that's fine. But for me personally, as a future nurse and paramedic, I love them because they're a non-invasive method of assessment, which you can do at the bedside. They actually tell you a lot about what's going on with the patient, and you don't need a doctor's order to do one. And in my undergrad degree, we don't really get into ECG interpretation very deeply, which is why today I'm going to talk about this concept of cardiac axis. And this is a concept that I came across while I was doing some research for a Para 213 essay. And I was actually quite disappointed that we didn't get to cover it in our main syllabus because I feel like this is a very important aspect of ECG interpretation. In fact, some textbooks usually go on to refer to the cardiac axis as a basic skill of ECG interpretation. So without further ado, let us begin. Alright, so what is the cardiac axis? Well, there are a few different definitions out there, most of which are too mathematical for my own liking, but basically, you can think of the cardiac axis as the average direction of depolarization in the heart. So, if you were able to take all of the depolarization vectors across the entire myocardium and you were to figure out the mean direction that they were going in, well, your result would be the cardiac axis. So in a healthy adult, the cardiac axis is said to lie between -30 and 90 degrees, and that's going to make a lot more sense when I talk you through the physiology. But what you need to know is that certain disease processes can cause the axis to shift outside of these values, and that's why it's really important to know about cardiac axis. So today we'll be discussing the physiology of cardiac axis. We'll talk about some things that might cause the axis to be abnormal, and we'll have a practice at identifying the cardiac axis on some ECGs. So what I've got here is a diagram of the frontal plane of the heart. Can you remember which leads look at the frontal plane of the heart? If you said the limb leads, then well done, you're correct. And what I'm going to do is I'm going to superimpose this sort of hexaxial reference system on top. This is essential to how we measure the cardiac axis. And I'm going to label our limb leads 1, 2, 3, AVR, AVL, and AVF. Hopefully this is all still making sense so far. So if we were to think about the average direction of depolarization in a healthy adult, it would follow a roughly southeasterly direction because the left ventricle is the biggest part of the heart and is conducting the most electricity. And that's why we say in a healthy adult, the normal cardiac axis is between -30 and 90 degrees. So if the impulse travels anywhere within this region, it's normal. But sometimes the left side of the heart is actually consuming even more electricity than normal because, I don't know, maybe there's some left ventricular hypertrophy, or maybe there's some kind of aortic stenosis which is placing extra strain on the left ventricle. And when this happens, the cardiac axis shifts to be somewhere between -30 and -90 degrees. And this little region here, is a left axis deviation. Now, sometimes the right side of the heart is consuming more electricity than the left because could be a lot of reasons. Maybe there's some kind of pulmonary hypertension causing right ventricular strain, or maybe there's a lateral wall infarct, meaning that the left side of the heart is bust. There are a lot of reasons, but basically, if you do have a right axis deviation, it means that your cardiac axis has shifted to be somewhere between 90 degrees and 180 degrees. So in here, this region here is a right axis deviation. And rarely, the axis can shift even more into what is sometimes referred to as no man's land, or I prefer the term extreme right axis deviation. And that basically means that the impulse is traveling somewhere between 180 and negative 90 degrees. This is pretty rare and is usually associated with severe illness like ventricular arrhythmia. Here's a list of the common causes of left and right axis deviation. I'm not about to go through the pathophys of each one, but you can certainly hit me up if there's anything that you want explained a little more. Chances are that I won't know the answer, but I'll try and find out for you. Oh, and I suggest that you do check out this condition called dextrocardia. It's quite rare, but it's super cool, where basically the heart is flipped like a mirror image, so it tilts towards the right rather than the left, like in most people. Not a bad conversation starter. Well, if you keep pretty dry company like me. Oh, and another thing that isn't listed here that I should mention is that incorrect lead placement can also cause a false positive in axis deviation because, well, you know, duh. Incorrect lead placement. Okay, so that's all well and good. We now know what a cardiac axis actually means for us clinically. How are we going to spot the cardiac axis in an ECG? Well, it's actually quite simple. There are a few ways, but the fastest way for us in paramedic land is mainly to look at leads 1 and AVF. I'm just going to go ahead and pre-fill these in. 1 AVF. So, if you've got a normal cardiac axis, the impulse is traveling somewhere in this sort of direction. So, your QRS complex is going to be mostly positive in leads 1 and mostly positive in lead AVF. If, however, you have a right axis deviation, the impulse is traveling sort of that way. So, your QRS complex is going to be mostly negative in lead 1 and see, negative because it's traveling away from lead 1 over there. And it's going to be mostly positive in lead AVF. Now, if you've got a left axis deviation, impulse is going somewhere that way. So your QRS complex is going to be mostly positive in lead 1 and negative in lead AVF. Now, left axis deviation is a little bit different and trickier because technically that criteria might mean that the axis is within that negative 30 to 0 degree corridor, meaning that it would actually still be a normal cardiac axis. So to get around this, we basically just additionally look at lead 2. And if the impulse is additionally negative in lead 2, you've got a definite left axis deviation. Check. But if the lead 2, the impulse is kind of equiphasic, the QRS complex is sort of equiphasic, meaning it's the same distance above and below the isoelectric line, then you've just got a normal axis deviation. And of course, in extreme axis deviation, you're going to have a negative QRS complex in 1 and a negative QRS complex in AVF because, you know, impulse is going that way and it's not going towards any lead in particular. Alrighty, so here's a table summarizing what I've just described. You can screenshot this, memorize it, and I promise that basic axis interpretation will be so simple if you know this table. Alrighty, so let's have a practice at some ECGs. Can you pick the axis in this one? You can pause this video if you want more time with these ECGs. The QRS complex is mostly positive in lead 1 and AVF, therefore it's a normal cardiac axis. Here's another one. The QRS complex is mostly negative in lead 1 and positive in AVF, so this patient has a right axis deviation. What about this one? It's positive in lead 1, negative in lead AVF, and equiphasic in lead 2, so it's actually a normal cardiac axis, somewhere between -30 and 0 degrees. What do we think of this one? It's positive in lead 1, negative in lead AVF, and negative in lead 2. So it's of course a left axis deviation. And I'm sure some of you would have noticed that this patient is also having a left bundle branch block, so really it's no surprise that they have a left axis deviation as well. Wouldn't want to be this person. It's negative in lead 1 in AVF, so this is of course an extreme right axis deviation. Alright, thanks so much for listening. I really had a lot of fun with this video today. I love to hear any feedback you guys might have. Like I said before, I'm no expert, definitely not an electrocardiologist, and I'm totally happy for any comments, so my email is listed there for any correspondence. Here are some references. Big thanks to the good folks at Life in the Fast Lane who supplied all of the ECGs that I used to make this video. I'm not making any money from this video, so if you're one of those guys, please do not litigate against me.